In the Know, a radio program talking to the newsmakers in Ogle, Lee, DeKalb counties and beyond, keeping you in the know. Here's your host, Charles Van Horn.
Good morning. Happy Sunday. Joining us with Birth to 5 Illinois, the Regional Council Manager, Abby Hoskins. Also with us, Lois Meisenheimer, the Early Childhood Programs Coordinator with Sauk Valley Stars and the Sauk Valley Stars Chair. Good morning.
Good morning.
Abby, first off, Birth to 5 Illinois is a statewide effort to strengthen early childhood systems through a lot of community-based programs. And the reason why we're talking today is because there was a big statewide investment of money going towards Birth to 5 and Sauk Valley Stars Coalition. First off, Abby, just give a little brief overview about what Birth to 5 Illinois' goals are in regards to early childhood development.
Yeah, so Birth to 5 Illinois works in every community throughout the state of Illinois. For us, specifically in Region 47, we cover Lee, Ogle, and Whiteside counties. And our goal is to basically provide a statewide mechanism to engage local community members. So we want to understand how families are accessing early childhood education and care services, be able to inform decision makers and the community about these services that the families are saying they need. And then we work with the community to create an action plan that has identified those needs and expansion. And we're really fortunate in our region that we get to partner with the Sauk Valley Stars Early Childhood Coalition to bring these needs to light and then work together on this plan to kind of solve some of these recommendations and improve early childhood in our region.
And now, Lois, tell us a little bit about what STARS is exactly.
Sure. We are a regional coalition of early childhood service providers. And when we think of early childhood service providers, it's not just preschool providers, childcare providers. It's really the providers that are providing services to early childhood participants and their families. So it could be mental health providers that are helping to stabilize parents that are, providing care to their young children. It could be healthcare providers that are helping to improve the health of both parents and children. It could be the faith community that is providing those social supports, mental health supports, in addition to all of the traditionally thought of early childhood providers. So we work to bring those providers together and provide an active voice and move the programs and work forward in our community.
Abby, Birth to 5 Illinois and STARS work together hand in hand in the area. And big news, the Regional Office of Education 47 is helped you guys get together and get a little bit of money coming your way. Part of the $2.5 million statewide investment funding from the Illinois State Board of Education. You guys will be receiving $75,000 as part of that program. First off, how long was the process to apply for it, and how excited were you guys when you found out you got it?
Yeah, so the Sauk Valley Stars Coalition received the subcontract. This is the fourth year of subcontract. So the process happens on a yearly basis, and Birth to 5 Illinois has been fortunate to be able to provide subcontracts, 2 different collaborations through the state, both through planning and implementation grants. So for the Sauk Valley Stars Coalition, they were an already existing collaboration, so they're able to implement these plans that they've already started to work on and continue to grow by using this contract. Different collaborations, depending on where they're at in that planning, could apply for these, and they've been able to come out on a yearly basis. So Lois can probably talk a little bit more about the actual applying for the subcontract process as far as a collaboration. But typically this happens once a year, and then they have the year to then implement those funds. And they've been doing really great work over the last 4 years and before the 4 years in our community.
So, Lois, when you guys utilize these funds, Obviously, a large portion of it goes to existing programs. Is this going to help expand some services as well, or just sort of keep a lot of the great services you guys provide going?
Well, both. So over the last 4 years, prior to the 4 years, all of the work that the coalition did was really on a volunteer basis. We had no money that was supporting the work of the coalition. So the regional office it serves as the fiscal agent for this grant, but that doesn't mean the money stays in-house necessarily. Some of the things that we have used that money for include coordination between early childhood programs, developing a more coordinated intake system for enrolling children in programs throughout the three-county area, providing parent education and outreach activities. That could be parent events. It could be parent-child events, parent education, and then also supporting workforce development through the community college. We also have coalition partners that serve to help develop the early childhood growth that's happening. So one of the things that came out of some of the work we have done over the last number of years is we identified a need for full-day preschool, and then last year we're fortunate to be able to open the full-day preschool for all expansion grants at Open Sesame in Dixon and at the Y in the YMCA, in Dixon as well. So 2 classrooms at each site, and those were really through the work of these subcontracts that made that growth possible. Another project that has been able to be supported is the growth of our IRIS network, which is our referral system that we use between partners. We have 150 partnering organizations now that coordinate through this IRIS network to make referrals to each other's programs. And since the start of that, about 2,000 families have been served with referrals. The other day I did a look at the numbers, and it looks about 65% of the families that were referred have actually accessed services, which if you think about if you make a referral to a service, that's a really high number, because a lot of times families will say, sure, refer me over there, with not really any intention of following through on that referral. But because we have that IRIS network, the providers can have the names and the connections and can reach out to the families. So it provides another point of contact, and families are more likely to access the services they need.
Talking about families, Abby, for those that aren't really familiar with birth to 5, let's just lay out a hypothetical. Say I have a 4-year-old in Lee, Ogle, and Whiteside counties that may or may not have special needs, and I call you guys. What exactly can you steer me in the direction in regards to assistance of, and sort of sort me out in regards to state programs and the like that could assist?
Yeah, so Birth to 5 Illinois is more of a backbone agency or a connecting agency. So we are very fortunate that we get to work with all the awesome providers in our region, like Sauk Valley Stars, or our preschool programs in the schools, Head Start, 4C, who is our childcare resource and referral agency. And by bringing these people together at kind of the metaphorical table, we have these conversations of making sure that we have good systems to refer, or utilizing the IRIS platform like Lois just talked about. So if a family's coming to us, we are definitely connecting them with the people doing the work in our region. And we heard that just general awareness was one of the things that we needed to work on. So through working with the Sauk Valley Stars Coalition and our action plan that we created with the Family and Action Councils at Birth to 5 Illinois, we created the OWL Early Childhood Resource Hub, which is Ogle, Whiteside, and Lee. That also can be an additional resource to connect those families. We also work with the Family Council, which is families raising children 0 to age 8, living in Lee, Ogle, and Whiteside counties, and hearing from them has been really monumental in making sure we have that piece of connecting with our community leaders and the STARS Coalition, but then also bringing in that family voice, because we want them centered in that decision-making and also making sure we're actually getting the resources out the correct way that's actually helping families. So that's been really great for us to have that insight and center their voices throughout this whole work.
A lot of great progress has been made in connecting families with the support they need. Lois, do you know of any great success stories from the last couple of years where you've really helped turn a situation around for a specific family?
Let me think about that. I think more overall, it's just awareness of resources. Because my program that I coordinate is headquartered at the Regional Office of Education, and we are located between Goodwill and Dollar General in Sterling. We have people that walk in off the street all the time and say, I had no idea where to go, and I saw your sign, and so I thought I'd stop in and ask questions. And we had somebody here last week that had a child with special needs and didn't even know where to start, and just sat down with me in my office and asked questions. I was able to provide him with about 4 different connections because of our work with the STARS Coalition and our partners. And that's not exactly what my job is, but because of the conversations we have, I have the knowledge to be able to say, I can't provide these services, but here's who you can contact. And so he left with a bunch of information and phone numbers, and felt like he was more empowered as a parent to reach out to those because he knew where to start.
We talked a little bit about the numbers of children involved in this in any given year. I assume you guys are looking to expand. What type of reach do you think is necessary in regards to how many children, and this may be an unknown, but how many children do you think are slipping through the cracks whose families aren't using some of the partner agencies you work with?
So when we did our initial early childhood regional needs assessment, we definitely heard that it's not one size fit all, and definitely wanted to recognize that every family has different needs. We definitely have what we call a slot gap when it comes to childcare in our region. So for families that are working and wanting more of traditional center-based or family childcare spots, there are definitely not enough spots for every family. We know that not every family chooses that, though. So some of them want different routes, such as family friend or neighbor care. They want to go a preschool route, and we definitely respect that. And that's something we've been talking about, is making sure that we continue hearing from the community so that way we're not just blindly planning, and understanding that we need different things. So like Lois talked about, the Preschool for All expansion and those 4 new classrooms, we heard that Preschool for All classrooms are wonderful, but some of those weren't working for our families because they were only 2.5-hour programs. So what the ROE, the Regional Office of Education, has done is be able to open up spots for families that need that longer extended care, and then also partner with the child care centers who then can offer that wraparound. So hearing her talk about that is just really awesome to hear that just in a couple short years, it was identified as a need. The community came together and collaborated, and then the STARS partnership was able to step up and create those classrooms, and they continue to talk about that. So they continue to have those discussions of where else is this needed in our 3 counties, how many classrooms, how many spots, and what does that look like? And so we're definitely continuing those conversations and seeing how many spots we need for different families and really truly meeting their needs.
Abby Hoskins with Birth to 5 Illinois, and and Lois Meisenheimer with Sauk Valley Stars. Thank you so much for joining us today.
Thank you, Charles.
Thank you for listening to this week's In the Know. The program returns next week at this time with another great conversation with someone from your community.